can do on us, but it's not the only thing wreaking havoc on our bodies. Smoking and time are co-conspirators. Wrinkles are the definite sign that we're getting older, but Dr. Thomas Loeb says that you don't have to lie down and let time march on all over your face. He says hope is just a shot away. Welcome to the show.
Thank you.
There was a time when the only way to remove grooves and wrinkles was to get a facelift.
Right.
Is that changing?
Yeah, we've got a lot more small techniques that can sort of maintain you till you come to the age that you really feel like you need the big lift.
Yeah. There's Botox.
There's Botox.
Which sort of paralyzes the wrinkle.
Right. Well, I did a show before, and we showed you that Botox, for crow's feet, for the wrinkles up here, and for the furrows between the eyes.
And then you can have your own fat taken out of your fanny and put in your face, which is your own stuff.
Right. You can take your own fat and transplant it, and some of that lives, some of it goes away.
Yeah.
That's a good filling agent.
Right. But one of the ones that's the most common and that's been on the longest is collagen.
Right. Collagen's been around now for 17 years.
Yeah. And the only thing I would like to give a warning, because I'm very busy giving warnings on this program, is if you are allergic to animal products, and I am, you could be allergic to collagen because it's made from cows. Something.
Collagen, from cow's collagen. You must be tested for collagen.
Okay.
And the way we do the test is you have a skin test, and you either do 1 or 2 skin tests within a month period on your forearm. About 2 or 3% people are allergic to collagen. It'll show up like a little red spot on the arm.
Okay, we have Jillian Stockland, who has come today to get the collagen treatments, correct?
That's right. This is my second time.
What do you want to do? You want to get these grooves out?
Well, it's kind of a seasonal thing for me, and I feel like I could use another treatment. For me, it's non-invasive, and it's subtle. It makes me feel great about myself, and it's my little treat for taking good care of myself.
Where do you want it done?
Right in here.
Oh, there, down here?
No, just the grooves on the sides of my nose.
How long does it last when you do it?
For me, it lasts about 4 months because I did it in the springtime.
I see.
So it's like a nice little seasonal lift for me.
So people have to come back every 4 to 6 months, doctor?
They usually do. They don't have to. It's one of these things like...
Okay, so you can...
Go ahead and show us.
And tell us how much it does. If Star were here, she'd say...
Cut to the chase.
How much does it cost? How much does it cost? Well, how much is it?
Well, we'll get to that because I want to find out if it hurts. That's my question always.
Right.
Does it hurt, and what are the side effects?
Well, I gave her a numbing cream that when you come in the office, usually about 30 minutes before the procedure's done, we put on a numbing cream.
Well,
so
Novocaine.
She had like a Novocaine type cream.
I do have a little on
and some of it may be wearing off a little bit because of the makeup, but basically she had that. And then when they're numb in the area, it's clean again, and obviously then little injections are performed. And there are lots of little injections, but it's a very fine needle. So I don't, this isn't for everybody to watch, but it's a very fine needle, and it does not hurt very much at all.
Doctor, you're a dermatologist?
I'm a board-certified plastic surgeon.
So if you want to have this done, you go to a plastic surgeon?
Or a dermatologist,
Who knows
either
what
one.
He's doing.
Yes.
Isn't it more expensive to go to a plastic surgeon than a dermatologist? Tell the truth.
I don't know. In my office, it isn't. In fact, I think I charge less for collagen and Botox than a lot of dermatologists because for me and my patients, it's a very ancillary procedure. I'm not really making my living off doing this stuff.
So we can get through this.
No, don't let him talk while he's doing it. He should be walking.
Oh, I can talk.
He's a pro.
I can talk while I'm doing it. So first we're going to start.
I'm watching it,
It's injected under the skin. Little injections under the skin.
Does it hurt? Tell the truth. Nothing.
Not too bad. She'll give you a thumb up or thumb down, maybe. They're little injections, and we're going to inject pretty much this side.
Is that blood I see?
Yeah, a little bit.
A little blood. It's a little bit of blood.
Right.
But she's got
Don't you draw blood on this show?
Yeah.
Getting the fat out of your own body is a whole other deal. I know Geraldo Rivera did. He got some fat taken out of his tush and he put it in his forehead, which I said, I pity the priest on Ash Wednesday. You know what I mean?
But anyway, doctor, this last...
We tend to use fat if a patient's already going under anesthesia and going to have a procedure done like a facelift. Most of the time I'll do, or liposuction, I'll do fat at the same time because they're already asleep and there's a lot of fat there to use instead of throwing it away.
Okay, so you have let's just see a before and after picture of somebody who has actually done this and had some time to see. That's pretty good. That looks good. She had some deep grooves there, this woman, and now she's smooth.
And how much does it cost ordinarily?
That would cost probably about $375.
To have all of those lines.
Yeah. To have all
Okay,
those lines
let's recap now. It costs about $375 for the procedure for these grooves, right? It takes roughly 20 minutes to do these grooves?
Well, with the office numbing medicine, a little bit longer, but it obviously takes only 5 minutes.
You can do it in your lunch hour, is what you're saying.
It's a lunch hour.
Yeah, but the blood's a little bit of a side effect.
No,
Well, this will be gone.
Stop.
Okay, and the longevity of this procedure?
About 4 months.
4 months.
And by the way, you cannot put in your medical insurance for it.
No insurance.
For any kind of almost any kind of cosmetic.
Okay.
And I have to add, it's very subtle and it makes you feel great about
And
it.
you're still
And you look
talking.
fabulous.
Right.
Thank you, Dr. Loeb and Jillian Stockland. When we come back, if your brassiere is looking a little empty, we'll show you how to have a shapelier figure instantly without the bother, the cost, or the risk of surgery. Now, this I've got to say. We'll be right back.